Most people assume expired medication becomes dangerous the moment the date passes. They picture pills suddenly turning toxic overnight. But expiration dates usually don't work that way. In many cases, the bigger issue isn't immediate danger. It's uncertainty. Will the medication still work? Will it become weaker? Could it fail when you actually need it most? That uncertainty is what creates the real risk. Because expired medication exists in a strange psychological space. It feels almost usable, not completely safe, not completely unsafe. And that gray area causes people to make decisions based on assumptions rather than understanding. Maybe they find an old prescription in the cabinet during an emergency. Maybe the pharmacy is closed. Maybe replacing the medication feels expensive or inconvenient. So they look at the bottle, check the date, and ask the question almost everyone asks at some point. How bad could it really be? The answer depends on something most people never think about. The expiration date is not usually the point where a medication suddenly becomes harmful. It's the point until which the manufacturer can confidently guarantee full potency and stability under proper storage conditions. That distinction matters, because many medications slowly lose effectiveness over time. Heat, moisture, air exposure, and light gradually change the chemical stability of the drug. Sometimes the change is small, sometimes it's significant. And the problem is that you often cannot see the difference. A tablet may look perfectly normal while no longer delivering the intended effect. That becomes especially important with medications where precise dosing matters. For example, medications used for severe allergic reactions, infections, heart conditions, or seizure control may become risky if reduced potency leads to delayed or inadequate treatment. The real issue isn't always toxicity, it's reliability. If a medication no longer works predictably, the condition it's meant to control may become the actual danger. And that's where people often misunderstand the risk. They focus entirely on whether the expired medication itself is harmful. But in many situations, the bigger concern is what happens if the medication fails to work when it's urgently needed. Imagine someone relying on an expired inhaler during a severe breathing episode, or expired antibiotics that no longer effectively treat an infection, or emergency medication that delivers only partial effectiveness during a critical moment. Those situations are dangerous not because the medication suddenly turned poisonous, but because reduced effectiveness changes the outcome. There's another layer most people overlook. Storage conditions matter almost as much as time. Medication stored in a hot car, humid bathroom, or exposed to repeated temperature changes may degrade faster than the expiration date suggests. Meanwhile, some medications stored carefully in cool, dry conditions may retain partial potency long after the printed date. But that creates another problem. There's no reliable way for most people to measure how much effectiveness has been lost. The pill doesn't announce that it's now 70% effective instead of 100%. And that uncertainty makes self-judgment difficult. Some medications may remain relatively stable past expiration. Others may not. The challenge is that the consequences vary depending on the condition being treated. A slightly weakened allergy medication may be very different from a weakened heart medication or emergency treatment. The real issue isn't simply whether expired medication still works. It's whether you're willing to depend on uncertainty during a moment that may require reliability. That's why healthcare professionals usually recommend replacing expired medications whenever possible, especially for treatments connected to serious or rapidly changing conditions. Not because every expired pill becomes immediately dangerous, but because predictability matters in medicine. And once potency becomes uncertain, predictability starts to disappear. This also explains why people should avoid stockpiling medication indefinitely, just in case. Over time, old medications create a false sense of preparedness. You feel protected because the bottle is still there, but the actual effectiveness may no longer match your expectations. And that mismatch can become dangerous during an emergency. The goal is not fear, it's clarity. Expired medication is often less about sudden toxicity and more about declining reliability. And understanding that difference helps people make calmer, more informed decisions. If you'd like a structured breakdown of which types of medications become more concerning after expiration and why storage conditions matter, there's a practical guide linked in the description. And if you value educational videos that explain the logic behind everyday health decisions, consider subscribing. Sometimes the biggest risk is assuming probably fine means predictable.